Hi there. Good morning if you're joining us from the US. Good afternoon if you're joining us from Israel. And welcome if you're joining us from anywhere else in the world. The American Society of the University of Haifa is once again delighted to be joined by Dr. Manfred Green, Director of University of Haifa's International Master's Program in Public Health and Global Health Leadership. Each week, Dr. Green has been discussing a new public health development around the pandemic, and today he'll be breaking down and discussing the 5 stages of grief. As always, we'll leave a link in this post where you'll be able to learn more about the university's ongoing response to COVID-19, and where you'll also be able to find information on how to support the university during this time. With that, I pass you on to Dr. Green.
Thank you very much, James, and to Jenny as well. Just before I came on, I was actually mentioning that I just heard a very good talk by Nicholas King from McGill on what he called weaponizing uncertainty. And uncertainty is certainly a key issue in the pandemic, as it is in most crises. So basically, we need to start looking at the ways in which we are coping with this amount of uncertainty and where we are basically in what I would call the 5 stages of the pandemic. And I've actually used it as an analogy for the grieving process, although I'll be more optimistic at the end. So let's just start with it as we go. You'll probably be familiar with some of these. You know, this is very common. When the outbreak or epidemic started in China, there was this denial that it was actually going to get out of China and that it was really a major problem. And this is common. In other words, you start with a warning and then you say, well, maybe it's not, it doesn't seem to be a problem. And people who will tell you this will be told it's not true. And I'd mentioned it earlier that we saw this amongst politicians, and particularly in countries that took some time to actually make the move to try and prevent the spread of the disease. And having passed through that denial phase, the next phase was actually an anger phase. And an anger phase, as you can start recognizing these stages, is the stage where, in fact, people were angry that it was happening and angry that they were at risk. It's a very normal reaction. So, here is a new threat, something that's going to cause disease and death. And it's not at all clear why it's occurring and how it's occurring and who it's going to affect. So there's this immediate reflex of what we would call anger. And we needed to get through this anger phase to really make ourselves act in the way in which we should in order to move against the actual outbreak. So you could see that also that some of the delays in imposing the restrictions on the public were related to the anger, because anger at something that was happening, which was unexpected and we were annoyed about, and anger by the public because now there were restrictions being imposed which were very inconvenient. And in fact, as we know, the restrictions that are being imposed now, people say for 100 years, but I don't think even in 1918 they were able to impose the kind of restrictions that are being imposed now. This is something that is a scenario that we had not really thought about as being possible, that basically, in a sense, the world just shut down and every country is almost isolated from every other country. It's an unusual and almost incredible situation. So there is this kind of, and then the next stage is what we would call the bargaining stage. And we're seeing this also now. What is happening now is that people are saying, wait a second, we were told that there were going to be 2 million deaths or 1 million deaths or 500, and it doesn't seem to be happening. It's true that there's this shutdown or lockdown, but in other words, we're now saying maybe it's not as bad as they say it is. And we're hearing people saying, well, maybe it's just like influenza. Maybe that's all, and that we've exaggerated its extent of its damage. And then, of course, you need to recognize that we're bargaining almost with ourselves, because we're trying to convince ourselves that it's not as bad as people say. And we're looking then for information that will be, in a sense, optimistic. And we'll be looking for the commentators who will be saying it really is much less than we thought it was. For example, the case fatality rate, which is basically the number of people who are ill that die from the disease, the percentage. So if 100 people get ill and 5 of them die, that's a 5% case fatality rate. So the argument in the beginning was that the case fatality rate seemed to be quite high. It seemed to be 5, 6, 7%. In other words, this was a very, very severe disease. And that's declined as there's been a more careful evaluation. It may be somewhat lower than that, and it may be 1%. So we're bargaining with that, even though actually when we get to the level where we are looking at the actual figures, we're still actually looking at a very severe disease, particularly as it can spread now amongst virtually the entire population, because very small percentage have actually been exposed, and therefore they're very vulnerable. So now we'll go to the next stage. And this is the next stage where we are, I think, around about this stage. In other words, we are to some extent in the depression stage, where we're saying it's hit us hard, it's still going on, we don't have a vaccine, we still don't have good treatment, and this is a bad situation, and we're not, and the economy is being hit very badly. So you're seeing a lot of these gloomy forecasts of what this is going to do to us. So we're remaining in this kind of situation that we don't see an actual end to it, and we don't see a solution. So in terms of the phases of grief and so on, the next phase, important phase, would be acceptance. And this is going to be an important phase, which will probably be, I hope, fairly soon. It'll be acceptance, not meaning that we're not still going to be trying to get a vaccine or a treatment, but we're going to accept the reality of this pandemic. We're going to accept that it is a severe disease, and we're not trying to bargain now that maybe it isn't. On the other hand, we're not depressed about it sufficiently to say there's nothing we can do about it, because we can do things about it, and we have done things about it. And the shutdown or lockdown has done a lot. Just to give you one example, in countries like Hong Kong, where during this time or a little bit earlier, there would be influenza, there is no influenza at all. So this is a good marker saying that infectious diseases such as influenza are not spreading, which means that this lockdown is very effective. But we can't live with this for a long period of time. So we will use this acceptance period to start judging how we're going to actually live with this particular disease for the next whatever period of time. And that depends, of course, on whether the disease actually changes in nature, or of course there is a vaccine. So assuming the vaccine is still going to take some time to come, and we guess it will take a year and a half or whatever to get a vaccine that could be used universally, and we hope an effective vaccine, and there'll be good treatment. This is the time basically when, if we're strengthening the medical services, and I've said this before, if there's a student, we are actually, first of all, giving security to people to know that if they do become ill, they will get the best treatment, and there will always be a place for them where they will be treated. So this is a reassuring part of the disease. Also, the actual treatments will be better for two reasons. One is because we hope there will be new medications, but the other, which shouldn't be ignored, is that the physicians now have much more experience and are gaining more experience with actually treating the patients. So you can see that the patient, there's been modification in the treatment. The use of ventilators is much less common than it was. So this is going to be another aspect of it. So basically now we've gone through these, and I'll sum up now. We've gone through these 4 phases, let's say 3, or we're in pretty much, I think, at the kind of depression phase, but we, I think, are coming out of it. I hope so. And at least we should be making efforts to come out of it. And we should now be in the acceptance phase, where we adapt to it. And when we adapt to it, as we have to many other things, we will actually adapt well. And probably there will be lots of obviously bad things about the people who have died and the people who have become very ill. But this is probably going to generate a new spirit of innovation, which I think is going to be totally new. We're going to actually have a new world that we'll be living in the next years to come. So there will be aspects of it that will actually be positive, although we don't like to talk about these things in positive. So we need to get over the side of it, depression, get into acceptance and move ahead. And this is what I recommend that we do now. Thank you.